Capital punishment, also known as the death penalty, is a state-sanctioned practice of killing a person as a punishment for a crime. It can be adopted for violent crimes, such as robbery or rape, for drug traffickers, or in the case of more serious crimes, such as murder and high treason. In some countries, it is also foreseen for crimes of opinion or sexual orientation and behavior, such as homosexuality and incest. The death penalty has been abolished or in any case not applied in most states of the world. According to Amnesty International statistics, to date, 54 states still maintain the death penalty as a sanction in their criminal systems, while 141 do not apply it in law or in practice. Among these, 109 countries have abolished it for all crimes. 7 countries have abolished it for common crimes, but it exists for particular crimes, such as those committed in wartime. And the remaining 25 countries, while maintaining the legal rule, have not applied it for more than 10 years. Among the countries where the death penalty is foreseen are Saudi Arabia, Iran, China, Japan, India, Pakistan, United States in 27 of the 50 federal states, Egypt, Nigeria, and other countries. Among the many methods of executing the death penalty, we find lethal injection, considered by many experts to be the most humane of death sentences. But is it really so? How exactly does it work? Let's go see it. The prisoner waits on death row, a special section of some maximum security penitentiaries, where he is imprisoned even for tens of years awaiting execution. On the day of the injection, he is bound to a gurney and taken to a special room, where an execution team awaits him. They insert the needle connected with a tube into the veins of the condemned, which passes through a special opening in the wall and reaches the adjacent room where the executioner is. The latter will have the task of injecting with a syringe into the tube 3 different substances in a very precise sequence. Between one substance and the next, the executioner injects a sodium chloride-based solution in order to prevent the lethal substances from mixing with each other and from forming solid particles in the pipes, obstructing them. The American jurists, for example, have asked themselves a question, that is, who could bear to have killed a person despite having had permission from the legal system? To solve this problem, 3 executioners participate in the execution. Each of them will choose one of the 3 available syringes without knowing which one has the lethal content. In this way, none of them will know who actually killed the condemned. Each state has its own pharmacological protocol relating to executions performed by lethal injection. According to the Constitution of the United States of America, the death penalty must always respect the 8th Amendment, which establishes the prohibition of inflicting cruel punishments on the condemned. Lethal injection typically involves the administration of 3 drugs. The procedure begins with the injection of a sedative in order to save the condemned person from the physical and emotional suffering of the execution. The first drug to be administered is sodium thiopental, also known by the trade name Pentothal. It belongs to the class of barbiturates and has a depressant action on the central nervous system. It is used in veterinary medicine to induce anesthesia in animals, but also to induce coma in the case of euthanasia. It is administered to the condemned and has the task of putting him to sleep. The drug quickly reaches the brain and causes loss of consciousness within 30 to 45 seconds. In the United States, there has been a shortage of Pentothal due to the refusal of European manufacturers to supply it for this use, and in addition, the only U.S. company has stopped producing it. It was thus decided to adopt pentobarbital, a fast-acting barbiturate also used for assisted suicide. At this point, the second drug is administered, namely Pancuronium Bromide, also known by the trade name of Pavilon. It is a very powerful muscle relaxant that serves to stop the prisoner's breathing and does so by paralyzing the diaphragm and lungs. It is a neuromuscular blocking drug that works by interfering with the activity of the receptors for the neurotransmitter acetylcholine present at the level of neuromuscular junctions, the points of contact between nerve fibers and muscle fibers. Pancuronium bromide is generally used in general anesthesia and in intensive care to facilitate patient intubation. At this point, the third and last drug, namely potassium chloride, is administered to the condemned man. It is a salt composed of sodium and potassium that is administered in a lethal dose in order to interrupt the electrical impulses that regulate the electrical activity of the heart. The result is cardiac arrest and death of the prisoner by depolarization of heart muscle cells. It is described as a liquid fire injected into the veins, capable of causing intense spasms, which are however prevented by pancuronium bromide. Once the three substances are injected, the heart can continue beating for a period that can vary from 5 to 15 minutes. The condemned person then passes from a state of unconsciousness to respiratory paralysis and subsequently to cardiac paralysis. The administration of this drug cocktail has been at the center of many debates for many years, as it has often proved ineffective. Sometimes the effect of sodium thiopental can fade before the administration of potassium chloride, making the prisoner regain consciousness, who dies in excruciating pain. However, once the neuromuscular blocking drug pancuronium bromide has been administered, it is difficult to tell if someone is suffering because they are no longer able to move or scream. There have also been executions where the prisoner survived the lethal injection for 35 minutes because the inserted needle did not pierce the vein but the soft tissues. Following some autopsies carried out on prisoners executed by lethal injection, the incredible was discovered. 3/4 of the more than 200 autopsies examined revealed that the prisoner's lungs weighed twice or sometimes more than normal weight. This was because they were filled with a mixture of blood, plasma, and other fluids, consequences compatible with pulmonary edema. The prisoner could thus die of an agonizing death by suffocation. These are surprising and unequivocal results, which raise the question of the actual cruelty of the lethal injection, which does not seem to be that quick and painless death that so much was said. These results have thus changed the lethal injection protocol of some states, which have gone from the mix of 3 drugs to 1 only or maximum 2. The issue of lethal injection always remains at the center of numerous debates in the United States and divides between for and against, between those who believe it is a just punishment for the crime committed and those who believe it is an anachronistic practice that takes away the right to life. How do you think? Are you for or against the death penalty? Write it in the comments.